I now welcome Dr. Udayasurian sir to shed some lights on emerging and re-emerging viral diseases of poultry in the current scenario. Kindly welcome, sir. Thank you very much.
Good evening to all. At the outset, I would like to thank the organizers, especially Professor Chandrasekhar, Dr. Magnathan and his group, Dr. Gopal Reddy, Edunandan, and my previous speaker for his excellent speech, for having given me this opportunity to share some of my views or some experience about some important poultry diseases today. So the topic given is emerging and re-emerging viral disease of poultry in the current scenario. So I am going to talk about some, you will see what is emerging and re-emerging viral diseases of importance today. And out of that, since the list is so many, so we will selectively talk about 2 important diseases, and finally we will summarize the thing. So if you see, normally a new infection or infestation resulting from the appearance of a new disease or reappearance of a disease that were believed to have disappeared, what we thought that it would have been disappeared long ago, but it's not new. It's happening again and again. Why? Because from the microorganisms point of view, if you take these microorganisms, when they face a situation of extreme vulnerability, it looks all possible gaps of the barrier to break down these barriers, so that we put in place to protect our animals against infection. So later we call it as this breaking of the sanitary gaps or as failures of the biosecurity system. So if you see the OEA definition of emerging and re-emerging diseases, a new infection or infestation resulting from the evolution of your microorganisms, or a change in the existing pathogens, or a known infection spreading to a new geographic area or a population, or previously unrecognized pathogenic agent or disease diagnosed for the first time, which have got significant impact on the animals. So when they are called re-emerging, a known or a disease, endemic disease to a particular area is considered to be re-emerging if it changes its location, or if it expands its host range, or significantly increases its prevalence. So if you list out some important re-emerging diseases, which is important at the point of economic loss to the poultry industry. Of course, we know the major devastating disease, avian influenza, both LPI and HPI, adenovirus infection. Out of that, 3 major symptoms are important, and variant IB infections, ILT, the Rio viral infections, chicken anemia virus, and avian metapneumoviruses. Since the list is very big, today I am going to talk about 2 important viral diseases, which is economically and health point of view also very important for our industry. That is adenovirus and infection, IB, infectious bronchitis. So when you see that adenovirus, it's a very diverse group of virus belong to the Adenoviridae family. According to this ICTV, that is the International Committee on Taxonomy of Virus, they classified this into 3 groups. For us, this group 1 is so much important that it has 5 species, A, B, C, D, E. Among this, in these 5 subspecies or subgroups, there are 12 serotypes, range from 1 to 2. 1, 2, 3, 4, 5, 6, 7, 8A, 8B, and so on. They are responsible for variety of clinical diseases of global importance in last 15 years. If you see the existence of this adeno, it is first, I think it first identified in early 60s. But of late, it will come and go, and it was not considered as much of significance. Sometimes it will come, it will go like that. But if you take the last 10 or 15 years, this is the prevalence of this disease is gaining importance, and you find it widespread throughout the world. This foul adenovirus disease can come as a primary disease, or it's a secondary infection, especially in broilers, whenever there is co-infections or there is some high immunosuppressants there. Of course, you know, this foul adenovirus can be transmitted both by vertical as well as horizontal. If you see as infection, mostly the young animals are suffering most. So this is the ICTV. I mean, these 3 classifications are there. US, UE, European Union classification, US, and ICTV. But the ICTV classification is widely accepted and being used. You can see, no, this group A, under each species, the serotypes are classified. If you take the avian adenovirus, there are 6 important diseases of the inclusion body hepatitis, hydropericardium syndrome, gizzard erosion, egg drop syndrome, hemorrhagic enteritis in Turkey, of course, marble spleen disease. Hardly we can find it. I mean, it's not in our chicken. It presents, and avian adenovirus splenomegaly also caused by the group of this thing. If you see that this map, this shows the global presence of where predominantly IBH areas and predominantly hydropericardium hepatic syndrome areas, and the area where both IBH and HS are coexist. You can see in Asia, especially India, most of the countries have both IBH and HHS. So if you take this inclusion body hepatitis, it's a very acute viral infection. It is mainly seen in 2 to 7 weeks old of broiler chickens. Of course, it is sporadically reported in layer and adult broiler breeders. There are many serotypes which is causing this inclusion body hepatitis. The virus, particularly the virus, belong to group D, but serotype 2 and 11. Of course, 9 also to certain extent. And in group E, that 8A and 8B. So these 2, 11, 11, 8A and 8B are very, very important to cause this inclusion body hepatitis. It is primarily affecting liver, spleen, pancreas, bone marrow, and thymus. Of course, there will be an intranuclear inclusion bodies in hepatocytes and pancreas and in some of the other organs also. So not only that these above mentioned areas, other organs, you can see some lesions in other organs also. The IPH symptoms in broilers, of course, the course of the disease is very short, about 4 to 5, 7 days, mostly 4 to 5 days only. But the outbreaks will reach its peak in 3 to 4 days after infection. Mortality, of course, ranges from 1% small mortality to even up to 30-40% also. The affected birds will show depression, they will prostrate, and there will be ruffled feathers, and the birds tend to have some huddling. Of course, resulting in poor growth and poor FCR. One significant point is the birds will suffer from hypoglycemia, metabolic acidosis, and hypocalcemia. So the treatment, when the affected flocks can be treated with the glucose to address the hypoglycemia, the sodium bicarbonate to address the metabolic acidosis, and some calcium supplements will help us. These are the common lesions. If you see in the liver, it will be very much swollen, pale, with extensive necrosis, which will look like a marble pattern. And this will be highly friable, will crumble easily. And significantly, you can see when you cut open the carcass, I mean the bird can see like a jaundice-like an appearance all over the bird, all over the body, particularly on the liver, kidneys, and the subcutaneous fat. Everything will look like an yellow. The inclusion body, I mean, inclusion intranuclear basophilic inclusion bodies can be demonstrated by means of histopathology in the liver, pancreas, and kidney cells. There will be splenomegaly, and the kidneys will be pale and enlarged many times, sometimes with hemorrhage. And pancreas, it will be a bit atrophic. It will be atrophic, and pettication will be there, and necrotic foci will be there all over the body, because it's a very much important, because it's a target organ. Similarly, there will be atrophy of bursa and thymus. So this IBH affected liver. This is one more liver. Your kidneys. See how they are pale and swollen. How much they are swollen. So how this virus spread? This has a very short incubation period, just 1 or 2 days only. The multiplication takes place in the respiratory and the digestive tract organs. And from there, it spread to other organs. The infected breeder birds, even without showing any clinical signs, they will spread the virus vertically during the laying period and cause the low hatchability, resulting in poor chick quality. And as a result, we'll see high mortality in the young broilers. The affected embryos, if there is a vertical transmission, the affected embryos will be dead. The virus will cause the death of the embryo. It will either in the middle or later stage. But if the embryo survives, the infection will stay latent until the chicks hatches out. And of course, horizontal spread also is possible through litter, water, and of course, men and material movement. In chicks, the infection can be latent, not be visible, but when they become grown, there will be some disease that is on later. I mean, 2 to 3 weeks or some 4 or 5 weeks also, there will be some disease later. And that forms a factor for inviting other diseases because it causes immunosuppression also. So the infected bird, the virus in the droppings, in the liver, spleen, trachea, kidneys, and intestine. The viral will have the particular tropism for particular organs depends on the age of the birds, the immunological status of the bird, and the strain of the virus causing the pathogenicity. Even if the birds look normal, healthy, You can still isolate some virus from the bird. So now we'll move on to some information about the hydropericardium syndrome. Hydropericardium syndrome or hydropericardium hepatitis syndrome is caused by a virus type C4, that is serotype 4. It will cause mortality in broiler, breeder, and sometimes in layers also in the chicks age group of 3 to 5 weeks old. If you see a lesion, there will be a straw-colored, clear straw-colored fluid in the pericardial sac. The liver will be so congested. There will be pulmonary edema. Kidneys will be enlarged, and of course, thymus will be atrophied. So mostly this disease, of course, it's vertical, but many times, and most of the times, it is spreading horizontally and associated with other immunosuppressive diseases like CAV and other mycotoxicity problem also. So this is the hydropericardium syndrome case. So now we will move on to the gizzard erosion problem. This gizzard erosion is caused by adenovirus serotype A1 and serotype 8. In E group, the 8 serotype will cause gizzard erosion, and the group 1, group A serotype 1 will cause this problem. But if you see, generally, you cannot see any apparent clinical signs in the broilers when they are getting affected. But sometimes the symptoms found like depression, the body weight loss, a lot of uneven growth, and mortality will range from 6 to 10%. In postmortem, you can see a black-colored hemorrhages or a black-colored fluid filled in crops, proventriculus, gizzard. Because of that, they are all look like distended. And there'll be multiple black patchy erosion in the coating layer of the gizzard. But at the same time, we have to rule out these erosion lesions with vitamin B6 deficiency, the amines, that is histamine and xerosine, something the fish meal, and of course some mycotoxins. Very rarely, this kind of lesions seen in layer pullet also. These are all some lesions in the gizzard. You can see the erosions, ulcers. Another disease is from the adenovirus is egg drop syndrome. Of course, it is mainly in the egg type layers. Originally, this virus came from ducks, the isolated ducks only. Later on, it became infective to the chicken. Once this virus affected, there will be significant loss in the egg production, up to 40 to 60% loss will be there. The disease will be severe in broiler breeders and particularly brown egg layers than the white egg layers. So after the infection, the layers will produce pale eggs, soft-shelled and shell eggs, even without showing any symptoms, disease symptoms. So there'll be watery albumin. The size will be egg size will be very small. Bird will not take feed. They will become dull, and there'll be diarrhea. In cage farms, the disease spread is very low, but of course, the egg trays play a major role in transmitting the disease to other birds within the house as well as from shed to shed. Of course, there is commercial inactivated vaccines available. Here again, we have to make some differential diagnosis with IB, avian influenza, Newcastle disease, and vitamin D3 deficiency. So, what about India? What is the prevalence of this fowl adenovirus in India? If you see the prevailing serotypes in India, already people have isolated serotype 2, 4, 5, 6, 7, 8, and 12. In the broiler chickens affected with idiopericardium syndrome or IBH. But if you see of late, more than serotype 4, if you go to any corner of India, you can see the prevailing serotype is 8, particularly 8B and serotype 11. This is predominantly and frequently encountered throughout India. Of course, even though you can see this problem is occurring throughout the year, but the major outbreaks are seasonal, especially during the monsoon season from May to September. If you see the character of this virus, some of the strains cannot induce the disease by themselves, but when there is a multi-etiological and other, when there is a co-enzymes, I mean co-infections, the pathogeneity is role is different. It is very important. In primary, the primary infection, that is, if the disease caused by the fowl adenovirus by themselves, the severity depends on the virulence of the particular serotype than the virulence caused by the co-infections. And one important point here is there are no cross protection among the serotypes, because there are different opinion, but it is well proven that there is no cross protection between serotypes. So whenever there is the different serotypes problems are there, we have to go for the vaccine or whatever maybe with a particular serotype, including the particular serotype. So these are all some of the co-infections. You can see, particularly in broilers, the IBD and CV are always the predisposing factors for the IBH to occur. Apart from that, the co-infection, when the infection comes, these are all the co-infections like avian influenza, reoviral infections. Nowadays, we are seeing a lot of cases combined with this IBH and reoviral, which aggravates the situation. And of course, the IBH, infectious bronchitis, chicken anemia virus, Marek's disease, and feed mycotoxicity. These are all causing the immunosuppression. So this virus can be detected by way of virus neutralization from the serum samples. So to isolate the virus, you need some cell cultures, immunofluorescence assay. But of late, a lot of identification of the virus is done by molecular techniques, PCR, RT-PCR, and DNA probes, etc. So if you come to the prevention and control aspects, of course, being a viral disease, there is vaccination is the only way. So vaccination of breeder and broilers are very, very important. In breeder, to protect the birds as well as to give proper maternal antibodies to the progeny, it is recommended half dose of the combined kill vaccine in the early life of the chicks. And in 12th and 19th week, combined, that is the multivalent, polyvalent killed vaccines can be given. Sometimes if you don't protect the birds, if you don't give this IBH vaccines to the parents, but there will be a problem in the field, in the broilers. So what best you can do is, at least you can give the killed vaccine at day one in the hatchery, either in the hatchery or in the farm, preferably in the hatchery. At least this will give you some 75 to 80% production, if not 100% production, at least 75 to 80% protection to the broilers. So effective control should be aimed at breeder flock level to provide enough MAB transfer to prevent the disease in progenies. If you, but for breeders, you have to vaccinate the flock when they are in rear. Suppose if the flock got exposed in the laying period, any number of vaccination after the exposure will not help us to control the disease in the progeny. So this virus is very hard and highly resistant to commonly known in disinfectants, and of course for the thermal inactivation also. But this is somewhat sensitive to formaldehyde, lime, and glutaldehyde disinfection. So if a farm is affected, once affected, there may be a chance of recurring infection in next 2 or 3 consecutive flocks if proper cleaning and disinfection is not carried out. So effective biosecurity is very important to prevent the horizontal infection of the horizontal infection. Of course, you have to always reduce the stress of the bird and control the mycotoxins in the feed. So when you come to the next part of the presentation, infectious bronchitis. Of course, everybody know that it's a coronavirus. Primary target of the virus is respiratory tract. It replicates in the urinary tract, genital tracts, and gastrointestinal tracts. It is very host specific. It is the disease of and of course it's very contagious. The spread is very quick. Within 1 to 3 days, completely the entire farm or the entire house. Of course, it can. So as I told earlier, the inspection. Okay. Because of its rapid spreading nature, 100% of the flock will become rapidly. Virus is shedding in the tract and the feces. This shedding persists even after the clinical signs are gone, up to 20 weeks after the infection. So the virus excretion reaches the peak from the respiratory tract for about 3 to 5 days after the infection. So this is the course of the virus. It first affects the respiratory route. In 1 to 3 days, it affects the magnum, isthmus, and the shell gland damages. So the severity of the infection is influenced by strain of the virus, age of the virus, of course, some breed specific specificity is there, immune status of the birds, nutrition also play a major role, and of course, cold stress play a major this thing in aggravating the symptoms of the disease. So these are these virus spreads. Initially, it replicates here and then become a viremic stage, and then it reaches the air sacs, and next step is it reaches kidneys, oviduct, cecal tonsil, and poronucleus. So predominantly respiratory disease, so symptoms mostly pertaining to the respiratory systems, which cause high mortality in breeders and broilers. In breeders, it causes severe egg drops and other production problems. Of course, there will be egg quality problems also. In broilers and breeders, you can notice kidney involvement. In male breeders, sometimes it causes male infertility problems. So when the respiratory system is affected, this is the main site of virus replication, particularly that ciliated epithelial cells in the trachea. And also the Harderian glands, which is the mucus secreting cells. Because of that, you'll see the respiratory signs, including sneaking, sneezing, head shaking, conjunctivitis, tracheal rales, facial swelling because of the sinus inflammation. The birds will become depressed. They'll have the tendency to huddle under heat source. As a result, there will be reduction of feed intake. And finally, the weight gain will be very much reduced. The birds will recover from the disease in around 10 days. Of course, unless it is complicated with other E. coli, MGMS, and other problems. The respiratory tract lesions may include trachea, nasal passages, sinus. The sinus, these areas may contain serous or catarrhal caseous exudates. Air sacs have foamy exudates, which will be progressing to cloudy thickening. You can see the facial swelling, and this is the air saculitis. And of course, here, facial swelling should be ruled out with metapneumovirus, TRT, and the swollen head syndrome. Because in these diseases, like the other diseases, the percentage of swollen heads will be higher than the birds affected with IB. And of course, coryza is there because of E. coli, severe E. coli infection. Also, there will be facial swelling. And other when the frog is affected with other immunosuppressive diseases, so there will be some facial swelling out there. And most of the time, the swelling, facial swelling occurs combination because of the combination of these factors. And the nephropathogenic strain of the virus. Not all the strains are causing kidney lesions or nephropathic lesions. Some strains of IB is only causing young chickens, there will be nephropathy. Initially, the respiratory systems will be affected. Then it will be followed by depression, high water intake. Because of the high water intake, there will be wet droppings, and the feathers become ruffled. If you take the kidney, there will be some structural changes, some alterations in the tubular epithelial cells. So because of that, there will be impaired fluid and electrolytic transport. There will be a renal failure. So the nephritis and nephrosis will result. The blood uric acid levels will be increased. As a result, there will be swollen and pale kidneys, tubules, and ureters or distended with urates and uroliths. In extreme cases, sometimes the kidneys will become atrophied. Mortality will be very high. So if you see the effect on egg production, when the virus affecting the reproductive system of the birds, the production may drop up to 70 to 80%. There will be effect on the shell and albumin quality. So the calcium deposit will be very uneven, and the shell will become look like rough appearance. So there will be an increase in number of calyx because of the misshapen, thin and soft shells, wrinkled shells, pale color eggs, and the rough shells. The albumin becomes so watery, and the hatchability will be very much reduced because the embryos will be killed during incubation. The egg production and the egg quality can become close to normal, close to the original production, but it may take about 8 to 10 weeks. See, if you see the graph, this graph, so this is the before peak, and when the disease affected during the peak and after the peak. This is how the graph looked like. See, before, when the problem comes before the flock attain the peak will not be reached. So it will reach and almost close. After that, it goes towards the standard graph. Suppose if the disease affect during the peak, there will be a severe drop, and it takes some time to reach the standard production curve. But once the disease affects later on the peak, there will be a dip. And of course, during short period, comparatively during short period, it can again go back to normal, not exactly normal, close to normal. So the egg drops, IB virus affected eggs can continue even after egg production goes back to normal or near normal. But see, it ranges from 13 days to 75 days. And of course, this shell quality to certain extent will become permanent. So both internal and egg quality of the eggs will be severely affected. There will be some irregular calcium deposition on the egg. You can clearly see the normal albumin and the IB affected watery albumin. So when you come to the IB variants, because IB encountering these IB variants is a continuous phenomena over years. So this variance is seen in all regions of the world in the last several years. These are some of the variants in some other countries. The one beauty about this virus is anytime it replicates and will keep on changing. But there are studies which clearly demonstrate that use of live vaccines can also accelerate the mutation rate. And one of the major IB variant, which we come across in Asia and particularly in our country also, is IBQX strain. It affects the chicks in a very early stage, from day 1 to 14 days of age. Once the chicks got affected in the very early stage, it may cause some false layer or cystic ovary later in the layer life. So during the rearing period, this infection shows some respiratory symptoms, of course later oviduct lesions. If the after 25 weeks of age, there will be some egg production problems coupled with some respiratory problems also. Some co-infections you can see whenever there is an IB problem is MS, MG, LPI, HPI, ORT, and of course virulent RD. So nephropathic, reproductive and nephropathogenic strain throughout, you can see most of the Asian and Middle East and parts of Africa and parts of Europe. It predominantly affects the reproductive tracts, reproductive tissues of the birds. The false layer numbers will be high. It will be very clearly marked. The affected birds, they will fail to reach the peak production, or if they come into production, it will be very slow. New strains are coming up, and which are affecting kidneys and particularly the broilers. So some information about the false layer syndrome. See, false layers hence look very normal, and of course it will look. You cannot see it's an affected bird. It's look healthy and normal. They will ovulate normally. They will appear normally. The ovary, if you see the ovary, it will be very fully active with ovulates. And the secondary sexual organs like comb and what will be very well developed. So you cannot find any deviation from the normal bird. But these birds will not produce eggs because the oviduct become non-functional. So when the eggs or when the birds are ovulate, the ovum, instead of going into the infundibulum, it will get dropped into the abdominal cavity, and later on it will get absorbed. So this will happen particularly during peak production. This is because the birds are affected with the IB variant, like these QX and all, in the early stages of the life. So because of that, the ovary and oviduct become hypoplasia. So other causes of oviduct dysfunction with this similar inflammation and obstructions are, which will result in false layer, or MG, E. coli, MG and E. coli infections. This is the picture of the cystic oviduct, sorry. The QX strain affected birds sometimes look like they will give appearance of penguin-like this thing. The new IB QX in broilers, the respiratory problems start in 18 to 22 days of age, along with some kidney lesions also. 4th week, it may get complicated with E. coli, CRD. As a result, we will end up with high mortality. There will be some enteritis, proventricular lesions, and hemorrhagic ulcers. Similar to avian influenza, QX also changing its strain, its genetic makeup rapidly, very rapidly. It's mutated very rapidly. Of course, in India also, we are seeing this type of variants. There is one reference from Dr. Ganapathy and group. They published like this. Previous work in India has reported the presence of infectious bronchitis virus like MAS strain and 793B also. Since the first report of the IBV QX variant in China in 1996, QX-like strains have become have been detected around the globe, and they have isolated this virus in 2019. So, and we are now reporting QX-like IBV in India. So the QX is very much in India. So how this virus is diagnosed? We can diagnose the virus with clinical signs and the postmortem lesions. The very rapid spreading nature of the virus. And of course, we can do some virus isolation, but the isolation is will be very difficult after the early infection. You can isolate the virus from the feces, cecal tonsils, and kidneys. and it can be isolated in through embryonated allantoic route of the embryonated chicken, and of course through histopathology also can identify. So there is ELISA, but it cannot differentiate between serotypes, but it will be useful for seromonitoring and to identify the antibodies response in the serum. Of course, there is HI is there. It's very specific, serotypic, strain specific. Virus neutralization is there, but not all the labs are equipped to take up this test. And of course, there is flat RT-PCR. We can send trachea, sacs, lungs, kidneys, and fecal tonsils. This virus can be found out. There'll be by monoclonal antibody techniques also. For IB, there are a lot of differential diagnoses we have to make. For the respiratory forms, we have to rule out ND, avian metapneumovirus, ELT, there is ILT, coryza, ORT, and mycoplasma. They have common symptoms, similar symptoms. So when you come to prevention and control aspect, routine monitoring of the breeder flock and layer flocks for the IBV virus, it might help to make a correct diagnosis when the flocks are challenged. We have to prevent the secondary infections like E. coli by way of good management. Of course, in this situation, this biosecurity is a challenge because the virus is being carried on any equipment or egg trays and other equipments, people, cloths, everything. This virus is can spread through aerosol route. It is airborne for some considerable distances. One consolation is that it's not vertically transmitted. So vaccines are there for effective control of IB, but the right choice of vaccine is very, very important. So when you come to the vaccination point of aspect, heterologous live vaccines are highly effective. They will give local immunity and thereby the birds are protected. Killed vaccines can be given in the breeders for the progeny to develop the maternal antibody. But by giving these killed vaccines, we have it will be useful to have some systemic protection of the birds also, especially for this reproductive form. So to prevent the disease, disease in the flock, the local immunity in the respiratory tract is a major key. So people are going for spray vaccination or eye drop method to ensure that the proper virus vaccine is applied to the birds. By way of doing this vaccines, live vaccines, there will be improved protection from gut, respiratory, and reproductive forms. Of course, instead of using the same strain of vaccines, you have to go for heterologous vaccines like MA5, 4/91, along with the classic type of vaccines in the early life itself at regular intervals. So IVMA5 can be used at even at day 1 and then after every 4 weeks in the rearing period. Of course, in laying period also the IVMA5 can be recommended whenever there is an egg production issues are there, shell quality problems are there. You can recommend this IVMA5 in the laying period also. And we have seen some considerable improvement in the issues, in the problems. Because the traditional vaccines like mosaic vaccine and all, They will not give 100% protection to the birds whenever there is a variant strain is involved in that problem, in the disease. If there is some variant QX strain is affected, flock, the use of 4/91 vaccine may be particularly at the day 1 itself or at the 14th day can be useful, and it should be repeated in week 14. So we'll come to a conclusion. So the key points of this today's presentation is high BH is an acute viral infection. It's emerging disease. It's highly detrimental for this poultry industry, causing severe economic losses throughout the world. And of late, the serotypes 8B and 11 are commonly found across our country, which is causing this inclusion body hepatitis. So in that context, the identification of the prevailing serotypes and use of the suitable vaccine along with the control measures are very much important to manage these avian adenovirus infections. The IB infections also, it's more prevalent, causing problems around the world. The reproductive and kidney variant, that is QX, is causing major problems in certain regions, particularly in India also. So a good vaccination program will usually prevent these problems. Of course, there is always good management and biosecurity are in place, and we have to take care of a good biosecurity without any lapse. So I think I have come to so these are the presentation today. Thank you.